Hello, hello. Welcome back, everybody. Welcome back to the podcast. Hope you guys are having an amazing week, and hopefully, January is treating you very well since we are just in the middle of the first month of the year. Okay. This is probably where people are like, yeah, New Year's resolutions, which I know I talked about this like in the last podcast episode or even the one before that I really don't do New Year's resolutions. I create, a plan and a goal for myself and I execute it for 90 days and then I move on, once that 90 days is over and create a new goal so that it keeps me consistent during the year. So, yes, so lots of good things happening for the CAT Scan Guru podcast. So, make sure you guys check out the latest previous episodes because I talk about my new protocol book. So it's a general protocol book for all technologists out there, whether you're new, seasoned, need a refresher, doesn't matter. Or you're going through a CT program. It is basic general protocols of all the protocols I've ever used ever in my career. I've kind of gotten it together so it gives you a clear structure so you can have a guide while you're doing your CT training. And this applies even to travelers too. If you're a traveler, because you go to a lot of different facilities and you learn a lot of different protocols. So this is very useful for you as well. So make sure you guys check that out. Link is in the show notes, okay? Also, make sure you guys subscribe to the podcast, send it to a technologist that needs help in their education training. These podcast episodes are very useful for them. So make sure you share it, like, subscribe, the whole 9 yards. Make sure you subscribe to the YouTube channel because I've got a lot of good things coming to the YouTube channel with more educational material, educational videos on there, and all the protocol videos that I do on my TikTok page. They're all in a playlist there, so go check them out. Okay. Also, if you need help as far as a structured way to excel in your CT program, I have a course that is 3 courses into one. So it is the CT blueprint where I go over protocols like basic common protocols. I do contrast media and I give you the ins and outs of what you need to know as a beginner in your CT training. So everything is linked in the show notes. So make sure you go check that out. So in today's episode, we are going to be talking about CT workflow basics. This is everything I believe a new technologist needs when it comes to your workflow in CT, especially when you're doing your training. Even if you're a seasoned technologist, this is something that could apply to you as well, or a traveler, it doesn't matter. Because as far as workflow, it does change from facility to facility that you work at, especially if you're a traveler and you go to new places, if you're a new person, or sometimes the department, the workflow does change. I know ours has where they've incorporated some things, which it can improve the workflow, but it could also make things a little bit as far as getting the work done a little bit in a sense, give you too many steps. Okay. So is what I'm trying to say. But, that's what departments do to try to figure out how to improve things in the department when it comes to leadership and turnaround times and things like that. Not that we necessarily agree, but, it's for the needs of the department, and that's pretty much what they do. Okay. So these are some workflow basics that I think as a new technologist, seasoned traveler, whatever the case is, that I feel you should need. Now, we're going to be talking about, decision making when you're on the shift, real life scanning logic, patient safety, because those are things that are really incorporated into your workflow. So daily decision making. So deciding on, how many exams need to be scheduled, especially when you look at your work list. You have those inpatients that you have to fit in when it comes to, your ER list, your ICUs and all that gets ordered. So basically decision making on what takes priority. Now, we all know that strokes, traumas, ER patients are usually at the very top of that list, okay? And then we have to fit in, those stat ICUs, those stat inpatients, and we also have to fit in, those routine patients as well. Okay, so we're just talking about just the bread and butter. We're not talking about, cardiacs or biopsies because those are 2 separate things. Okay. We're just talking about your bare bones, just everyday scanning, everyday decision making. So we have to fit in a good workflow on how we go ahead and schedule these patients. So this is what I do. Now, I know when I'm running the charge desk, because usually all of us get assigned, weekly on if we're going to do biopsies, we're going to do cardiacs, we're going to run the charge desk, or you're just going to be a tech on the floor scanning, whichever the case is, right? So decision making is, I look at the work list every single day, and when I'm on the shift and seeing how many ERs are ordered, how many routine patients are ordered, how many ICUs, if there's any stats when it comes to ICU or inpatients, if there's pediatric patients, because the facility I work at, the hospital I work at, we are attached to a pediatric hospital. So we kind of incorporate those things. Usually, if I'm running the charge desk, we're always going to make sure that we get our ER patients done, because those turnaround times are very critical. And I know that's one thing that has been, just harped on us as far as a department on getting these turnaround times reduced. So because there's certain metrics and certain things that the hospital has to meet when it comes to CMS standards and Joint Commission, standards and things like that. Okay. And I know there's a reimbursement piece in there too, because those things are kind of looped in as far as those metrics. But the most important thing is the CMS standards and the Joint Commission standards that they uphold us to, as far as making sure that we continue our accreditation and keep those accreditations, right? So turnaround times are very big. So I always schedule all my ER patients accordingly. Now, I always fit in blocks when they call for a stroke, there's a trauma or things like that, or they want to expedite somebody on the list because this patient's very sick or they're very critical. So it just, you make time in that schedule to make sure that you do proper decision making. Okay. And then, of course, if they haven't, for example, called a stroke or a trauma, so we'll do like an ER patient and then a patient from the floor, or stat from the floor, stat ICU. So we fit them in between, okay? And make sure that we leave ourselves enough room to make sure that we can fit in a stroke, a trauma, whatever the case is. So that is typically like as far as decision making when it comes to that. So you have to decide, of course, we have our priority, which is the ER, the strokes, the traumas, if you work at a trauma hospital. And then you have, your stat ICUs, your stat inpatients, and then you have all the routine stuff. So typically when they want those turnaround times to be like tip top, we got to work on the ER list. And yes, we still have to fit in those stat ICU patients, absolutely, because they're just important as anybody else. But the thing is there's also this dynamic when we're trying to decide how to make sure that our workflow in CT is, constructive and it's, it flows good and it doesn't overwhelm or overwork all the techs. The thing is I think sometimes when emergency departments and folks that work in the emergency department, and I'm going to be very transparent here and very raw about this, is that some folks do not understand that the emergency room is not the only department that we have to service. We have to service the entire hospital when it comes to CT, okay? And I think a lot of people forget that yes, when you call and say, hey, I need to bring this patient over, and I said, okay, well, we have 3 strokes in the department because at my facility, we have 5 scanners. Okay. And we are a comprehensive stroke center. So I say, we have 3 strokes on the table. There is a really bad trauma in another room and a very critical ill patient in the department. And you're going to tell me over the phone that I need to pull one of those patients off of the table. No, that's not happening. If I'm telling you the dynamics of what's happening here, no, that's not happening. That scenario right there actually happened at the hospital I work at, where we had 3 patients that they called a stroke on. One of them actually got the medication, which happened to be the patient I was scanning. There was a really bad car wreck trauma in another room with about 20 or 30 people in there, making sure that they keep that patient alive to get all those scans, okay? And then there was a patient that was critically ill that went into cardiac arrest, was a post-cardiac arrest in the department. And the nerve for one of those folks, and I'm going to say ER resident, okay? I am very transparent when it comes to this. One of the residents to come over and figure out why we can't pull one patient off of the table. Well, when you look down the hall and you see what's happening, that's why. Okay. So I think folks seem to not remember that CAT scan services the entire hospital. And if it weren't for us, the entire hospital would probably shut down. Okay, so let's be very mindful, because we take decision making on how we're going to expedite these patients very seriously, and how we execute our work for the day. Okay, now we have real life scanning logic. So this is not like the shows that you see on television, because those are not realistic, guys. Okay, none of that is realistic. None of that is real. Doctors do not do the CT scans, and none of that shit applies to what we actually do. So logic is making sure you center the patient correctly, making sure your orders line up with the diagnosis. Because I can't tell you how many times I look at that work list and those orders do not match what the patient came in for, what the clinical notes say, or what the reason for the exam is. And a lot of times we have to question the order and making sure, hey, that this lines up with what the patient came in for. Because what that does is it turns into insurance issues, and then the patient is stuck with that entire bill. So we have real life scanning logic where we have to make sure that the diagnosis, the notes, and what the patient came in for matches everything, and that we are selecting the correct protocols, making sure we are doing the correct amount of contrast, whether it's with contrast, without contrast, if we're using rectal contrast, if we're doing PO contrast, whatever the case is. Those are the real logics of making sure that we do the correct exam for those patients. Lastly, patient safety. Patient safety is a very important thing. Making sure that we use our table straps, make sure that we immobilize the patient, make sure we educate patients on breathing instructions, to hold still. The reason why, if they move, that we would have to repeat their exam, and that increases their radiation dose. Making sure we center those patients correctly so that the correct amount of dose is used for that exam. Okay. Nothing is more just disturbing to continue to radiate a patient and increase their radiation dose. We have to keep them safe, making sure they don't get injured, making sure that you check those IVs properly as far as contrast, because contrast can be a very dangerous thing. And infiltrations are not to be taken lightly. So make sure you keep your patients safe at all times. Answer all their questions. Ask them if they have any questions. Explain things that a 10-year-old would understand, because that's how we have to explain it to the patient. They don't understand all that medical jargon and all the mumbo jumbo that we understand. Okay? So you have to explain it to them like a 10-year-old. Okay? In the simplest forms, because then they'll get it. And then you have some patients that are very informed and they know exactly what you're talking about. And then you could just continue and ask them any questions that they may have. Ask them, if you explained everything correctly and if they understand the whole 9 yards, and then any post-exam instructions that the patient might need. So those are all the things that can improve, that I feel from my perspective can improve your workflow. There might be some others that you use in your department. So there's always a way to improve the CT workflow to not only get the patients done in a timely fashion and to make sure that your department runs efficiently. Okay, so that is it for today's episode. So thank you so much for joining me in this episode. Make sure you guys check out the show notes and check out the courses, follow on TikTok, and subscribe to the YouTube channel. And thank you for making this show possible. So I will chat with you guys in the next episode.